Abdominopelvic kinesiotherapy for pelvic floor muscle training, a tested proposal in different groups. The abdominopelvic enclosure seems like a house, where the walls are presented by the abdominal and lumbar muscles, the ceiling by the diaphragm muscle, while the floor, as perceived by its own name, by the pelvic floor muscles. Recent studies have shown that exercise centered on the abdominopelvic enclosure could favor the pelvic floor muscle function. Thus, our proposal was to study the effects of abdominopelvic kinesiotherapy on female pelvic floor muscle function. 82 women participated in this study, being 11 nulliparous, 13 primiparous pregnant, 20 primiparous postpartum, and 38 postmenopausal, who were evaluated by digital palpation, surface electromyography, and vaginal dynamometry in order to investigate their pelvic floor muscle strength. 2 questionnaires from the International Consultation on Incontinence questionnaires were used in order to assess urinary symptoms. This intervention protocol lasted for 60 minutes, 3 times a week, totalizing 10 sessions, and was supervised by a physiotherapist using a gym ball. The protocol, which is going to be presented in one continuous series, actually was performed with 5 repetitions per series in each position, accompanied by both fast and sustained contractions of the pelvic floor muscles, according to Marquez and collaborators. The protocol is performed in 5 different positions: supine, sitting on the floor, squat, sitting on the gym ball, and finally, standing position. It begins with a respiratory exercise. In the supine position, there are 5 exercises. The participant performs hip flexion while alternately extending the knees upwards, followed by a series of lumbar column rotation together with abdominal muscle contractions, and the bridge exercise, lifting the hips up to form a bridge, always accompanying the respiratory movements. The next exercise performs pelvic dissociation movements, followed by hip and leg flexion, as well as extension, by moving the ball, always holding the contraction of the abdomen. Trunk and arm movements are performed in the sitting on the floor position, with the legs abducted. In the squat position, sustained pelvic floor contractions are performed. In the sitting on the gym ball position, anteversion, retroversion, circumduction, and lateral tilting movements are carried out. In the standing position, to conclude the protocol, the results were a significant increase in pelvic floor muscle strength was observed by digital palpation in all groups. This finding was confirmed by electromyography and vaginal dynamometry in the pregnant, postpartum, and postmenopausal women groups, with a concomitant decrease in urinary symptoms observed by the validated questionnaires. Accordingly, we conclude that the abdominopelvic kinesiotherapy program promotes an increase in pelvic floor muscle strength and a decrease in urinary symptoms. Therefore, it can be used in clinical practice.